people who are old enough to remember the sound of a ticking clock, they understand the reference when they refer to their heart as a ticker. That's a sound that refers to the ongoing heartbeat of the heart. But for almost 3 million people in this country, the mechanisms that regulate that familiar monotonous beat can go awry. Doctors call these disorders arrhythmias, and the most common of all is atrial fibrillation, also called AFib. September is Atrial Fibrillation Awareness Month, a commitment to spreading awareness about the condition. Atrial fibrillation is an irregular heart rate that can increase your risk of strokes, heart failure, and other heart-related complications. During AFib, the heart's 2 upper chambers beat irregularly and out of coordination with the 2 lower chambers of the heart. Although AFib itself usually isn't life-threatening, it is a serious medical condition that may require some to seek emergency treatment. Tri-County Heart Institute patient John Debilio was one such person. He explains the events leading up to his hospitalization and ultimately the insertion of a pacemaker to control his heart rate.
I was in my garage and I felt a tingling sensation in my head, and the next thing I know, I felt a warmth feeling on my cheek because I had passed out on my face. Why I woke up, I have no idea. My wife was in Boston visiting family, and I don't know how long I was out, but when I did wake up, I immediately went inside, called 911. The EMTs got there, and of course they brought me to the hospital. That's how basically I met Dr. Alvarez. She was the doctor on call at the Villages Hospital when they brought me in, and she came in, she examined me and diagnosed my problem that I needed a pacemaker. I noticed no difference at all, but the pacemaker in my case is in case my heart decides to slow down below 50 beats. And the way Dr. Alvarez explained it to me, that's when I'll get that little tingle, which I'll probably never feel, it'll get me back into, my heart back into sinus rhythm, and everything should be fine. I can't say enough about her. She's just a fantastic lady. She really is, and she's a good doctor, very good doctor. I'm extremely pleased with what she's done for me and my wife by keeping me around. You know, I was happy that it all worked out, for me, and I'm here because of her.
Dr. Nitza Alvarez, cardiologist at the Tri-County Heart Institute, is committed to helping her patients incorporate physical exercise into their routines. That's why she participates in the Walk with the Doc program. You can join Dr. Alvarez every second Saturday of the month for Walk with the Doc. Participants will enjoy a brief presentation of an important health subject, followed by a walk at your own pace, led by Dr. Alvarez. You'll find information on Walk with the Doc and the Tri-County Heart Institute when you click the My AFib Heart Story link icon online at yourhometownhealth.com.